Let's talk about sex, baby.
Hi everyone, we're Group 12 and we created a mobile application called LUSH, Learning and Understanding Sexual Health. The goal of our program is to promote comprehensive sexual education throughout our target population of young adults aged 14 to 23 in the San Diego area. Through the use of our mobile application, we are aiming to teach our target population safer sexual health practices in hopes of reducing the alarmingly high rates of sexually transmitted infections and teen pregnancies.
Evaluation question number 1. Is there a difference in sexual health knowledge between the intervention group and the comparison group? Evaluation question number 2. What is the correlation between sexual health knowledge and safer sex practices? And lastly, evaluation question number 3. What is the correlation between sexual health knowledge and STD testing? Our conceptual model meets participants at their current sexual health beliefs and introduces sexual health education within the intervention. This, in turn, leads to sexual health knowledge and engagement in safer sex practices. The desired outcome is primarily an increase in sexual health knowledge and participants engaging in safer sex practices. The secondary outcome is that participants will get tested for STDs regularly and engage in safer sex practices. The overall desired health outcome is a reduction in teen pregnancy and STI rates within the target population.
By outreaching to schools and campaigning through social media networks, we will be obtaining our sample population through a volunteer basis using non-probability convenient sampling, meaning anyone can participate as long as they meet our specified criteria. Due to the public availability of our application, we will be using a quasi-experimental design to evaluate our program's success. Qualitative and quantitative pretest surveys will help us to gauge our participants' baseline knowledge of safe sexual health practices, which will then be compared to similar post-test surveys after the intervention. The post-test survey will not only help us to gauge how much the active participant learned, but will help us to evaluate the dependent variables in our study in both the intervention and comparison groups. In order to evaluate the survey findings, we will use a chi-test that will compare two ordinal variables, which are frequency of testing and frequency of safer sex practices. We will also use a t-test that will compare a nominal variable, knowledge of sexual health, with an ordinal variable, frequency of testing. Both tests will help us to correlate any possible relationships between knowledge and sexual health, assisting in answering our evaluation questions.
Our first graph shows a correlation between sexual health knowledge test scores and whether a participant was within the intervention or not. In those who received the intervention, they scored higher on their sexual health post-test than the comparison group. If we account for validity factors, it could indicate that the intervention was successful in transmitting sexual health education. In our second graph, we see a correlation between sexual health knowledge and safer sex practices. According to this graph, those who scored higher on sexual health post-tests were more likely to engage in safer sex practices. Accounting again for validity factors, this could indicate that the intervention was successful in educating participants about safer sex practices and encouraging positive behavior. And lastly, a graph that shows the correlation of STD testing compared to access to STD testing resources. In those participants who had access to STD testing, all were tested every 6 months for STDs. Accounting for validity factors, this could indicate that the intervention was successful in educating participants about the importance of routine STD testing and encouraging positive behavior. These findings show that there is a positive correlation between the intervention group and increased post-test scores. Secondly, there's a positive correlation between the intervention group and safer sex practices. And lastly, that participants who had access to STD testing were more likely to get routine STD tests. The main conclusion that we can draw is that our sexual health education mobile app can be a successful learning tool in a non-classroom setting. This is supported by our intervention group's knowledge being positively correlated to safer sex practices and regular STD testing, as well as our quasi-experimental design, allowing our data to project true numbers in reference to the effectiveness of the application. The limitations of our evaluations include participants not finishing the course for various reasons, which doesn't allow us to accurately assess their knowledge. Additionally, the public availability of our app may lead to contamination. Lastly, our target population's age is particularly susceptible to maturation, as they are exposed to sexual health knowledge, possibly at home as well as school.